let's look at some of the lifespan studies on the studies we have available. The best studies we have available in looking at longevity with the most data, most blood tests, and the most ongoing years of study is in the Californian Seventh-day Adventists who live in Loma Linda near LA, right? It's the best data we have. Now let's look at, and it seems to appear that the Seventh-day Adventists actually lived longer than the average Okinawans. The average Seventh-day Adventists lived longer than the Okinawans. Of course, the Okinawans who lived the longest were the ones who ate the most vegetables. Very clearly, you can plot the lifespan of the Okinawans based on their vegetable intake. Similarly to the Loma Linda Seventh-day Adventists. Now, I'm saying the Dr. Furman Nutritarians live much longer than the Seventh-day Adventists and the Okinawans. And how can I say this? By a lot of the theory and science I'm presenting to you today? Yeah, but also, don't forget, I've been a doctor for more than 25 years now. So I've seen lots of patients that have come to me with severe medical problems in their 60s and 70s. And these people came to me as a last resort when they were told they needed angioplasty or bypass surgery or had serious diseases they wanted to get better from. And now these people are still my patients, and they're in their late 80s and their 90s, and they're thriving and doing great, and they're not dying. Like a guy named John Pelikowski. I don't think I have his picture here, but in one of my slides I have his picture. You know, when he's now in his mid-90s. He came to me when he was 18 years ago with triple vessel disease, told he needed urgent bypass surgery or angioplasty. And I said, no way, John. That doesn't make you live longer. In 12 weeks, we can get rid of your chest pain. In the amount of time you could be evaluated with an angiogram and have cardiac catheterization, have the bypass surgery, recover in the hospital, go to rehab, and go back to work again. And that same 12-week period, I could have all your chest pains gone, you could be all better, with not spending $200,000, and without taking away your brain function, exposing you to all those, And he went back to his cardiologist 12 weeks later without chest pain, and 3 medications couldn't control his high blood pressure. But anyway, he went back to his cardiologist, feeling better, 60 pounds lighter, chest pain's gone. The cardiologist said, this is fantastic. Just keep working with Dr. Furman, and this is great. He said, but I've never seen, ever, a person been able to reverse the heart disease before. Now, all they do is see, every cardiologist says that every time they see one of my patients. They always say, I've never seen it ever happen before. Well, it should happen to every patient. If you aren't practicing malpractice, every one of your patients should reverse it. The inherent basis of cardiology is malpractice. The basis of cardiology, because they evaluate obstructions or blockages that aren't the cause of heart attacks, and they treat them, which doesn't reduce the risk of having a heart attack, and they then send you out with the same risk factors you had when you came in, thinking you're better, thinking you're going to have a lower risk. But anyway, getting back to this John Pelikowski story, the reason I brought up John Pelikowski is because I'm describing something that happened to him 17 years ago, or 18 years ago, and he's still my patient today. He still comes in the office. But now he's no longer in his 70s, now he's in his 90s. And now he's chopped, now he's in better shape than he was in his, I know over the last 7 years of seeing John and other people like him, as they got older, their blood pressure got even better. After the first year, he's off medication for his heart blood pressure. But the next year after that, it's even better on no medication. And the next year after that, his blood pressure is even better on no medication. As he got older, meant more time that he spent on a healthy diet, and I've seen his cardiovascular tree even improve more and more as the years went by. And now he's in his mid-90s, who knows what'll happen to him? I don't know. He's not going to have a heart attack, that's for sure. But so I'm saying that there's no reason why these people who I've observed in my medical practice do phenomenally well and in great health. So let's go over the Seventh-day Adventist study for a minute, because most people are not familiar with what it really showed. It showed that the vegans who were on the low-fat vegan diet did not live as long as the non-vegans who ate a little bit of animal products, who ate nuts and seeds. As a matter of fact, nuts and seeds the inclusion of nuts and seeds in the diet was a bigger lifespan differential than was whether you included animal products or not. Let me explain this so you understand what I'm saying here. I'm saying here that the difference in people who ate a few servings of animal products a week to those that were completely vegan, that difference was like 1.5 to 2 years of life, not a great difference. The vegans lived a little longer, about 1.5 to 2 years longer on the average. But the ones who did not eat nuts and seeds, the low-fat vegans compared to the ones who ate nuts and seeds, had a 7 to 8 year difference in lifespan. So the not eating of nuts and seeds took away more life than the not eating of animal products gave them. Did you follow that one now? The longest lived ones were the vegans who ate nuts and seeds on a regular basis. So this slide says that the longest lived societies have something in common. Mostly vegetables, no processed foods, self-grown. A lot of these long-lived societies grow their own food. They have gardens, or they work in the fields. No overweight people at all. They're all physically active. They have warm relationships with other people outside of their immediate family. And they average less calories than they eat in America. Females average about 1,200 calories a day, males average 1,900 calories. The average American consumes much more than that, of course.